Hello, let me explain about what is this step-up program. Step-up program is basically about taking the patients through a step-by-step process. I am Dr. Karunakaran, Director of Spine Surgery at MGM Healthcare. When people walk to consult the spine specialist, they have got enormous anxiety. So we need to understand exactly what the problem is. So we want the patient to communicate about what exactly is their problem, what is the suffering, what are the things which they are not able to do, and what is that they are looking at. Of course, they want pain relief and get back to normalcy. So this has to be taken through a step-by-step process. First, we need to have good clinical history. When they tell the history from the background from which how it started, how they have been going through this healing process, what are the things which they have done and how effectively they have done so far, and what is the step which we need to do has to be understood when they tell their history in detail. And what are the investigations they have done? They might have come with an MRI or they might have come with an X-ray. What is the investigation which is more appropriate at this point of time has to be decided by the spine specialist. Once it is done, then we start understanding the problem and what is the therapy which they have to give. Should it be medication? Should it be rest? Should they be supported with a lumbosacral belt, or they need to have some complete rest which they have to stop their routine activities, or they need some more activities which would help them to strengthen their muscles or some stretches. What type of exercises has to be decided, and if they are not a candidate for exercises and they have got severe pain which is not allowing them to do some exercises, should I give them some oral pain medications which they have to take, or should I give some injectable pain medications? It's based on the severity we have to decide. Or if there is a severe pain which is disturbing their bowel and bladder dysfunctions, which would be an emergency. So we have to customize the treatment based on their symptoms. And the symptom, if it's been moderate and they are able to cope up with their activities, but they need to have a stop to their pain and suffering, then what we would do is to gear up the treatment to look at identifying the pain generators. Identifying the pain generators would require the patients to come into the operating room. This is done only after seeing all the investigations, the non-invasive treatments as well as the investigations are done. We take them to the operating room to identify which is the one particular segment which is actually generating the pain. We very often see on the MRI and X-ray there are multiple segments which are getting involved and multiple spots are possible for generating the pain. We specifically target the one which is clinically matching and give the injection in that particular level, which can be just a joint injection or around the nerve which we might give an injection. Once this is done, we are able to know exactly the pain generator, and the pain generator is identified. We start them on appropriate treatments, which can be, again we might fall back on braces and physiotherapy and targeting on only that particular area. And still the patient is not getting better with these sort of interventions, we might choose another minimally invasive approach which is called the endoscopic radiofrequency ablation or endoscopic decompression of one particular segment based on the symptoms which you have gathered or on the informations on the investigations like nerve conduction study, MRI, CT scan and X-rays. So all these tests are not done in one go, are done in a step-by-step process. And once this procedure is done in a step-by-step process, the advantage is the patient is able to understand how much of pain relief they have got, and we can decide whether we have to step up our treatments, like go in for invasive surgical modality like putting screws if there is any sort of instability or if there is a bony destruction, based on which the stabilizing component would be introduced, like putting screws and fusing it on a long run. So this is what we basically mean. We start with clinical discussion history, investigate appropriately, and based on the investigations we would decide the treatment protocols. Should it be physiotherapy, should it be medications, should it be injections, or should it be minimally invasive surgery or extensive decompression stabilization procedures. Thank you very much.